Hey everyone, it's Dr. Charlie Johnson, physical therapist, and in this video I want to share with you two very similar yet different cases of folks dealing with butt and leg pain. So as you'll learn, both of these men thought that they had piriformis syndrome and sciatica, when in actuality neither had piriformis syndrome and only one had sciatica. And so I want to share these two cases in hopes that it helps you identify what could be going on with you. If you're watching this video and you have some type of butt and or leg problem and you're just confused about what could be causing it. And also I want to help you understand how to think through identifying what could be going on. And if you haven't done so already, I would recommend you check out my DIY diagnostic guide. Basically walks you step by step through my entire diagnostic algorithm in a flowchart fashion so that you can start to figure out what could be going on and what could be the cause of your symptoms. And without further ado, let me introduce you to Harry and Lloyd. All right, scratch that. Okay, the real Harry and the real Lloyd. So I'm going to share some sort of highlights from their case, so please watch and listen carefully. All right, so Harry has had pain for the past 5 or so weeks. Lloyd has been in pain for the past 6 to 7 weeks, a pretty similar timeline of symptoms there. Neither Harry nor Lloyd, or Lloyd, however you say it, has any back pain. They have no pain in the back. But Harry and Lloyd both experience pain in their left butt cheek as well as in their hip, and it travels down their leg. I'll tell you why I'm highlighting this in a moment, but just know that Lloyd has no trouble going from a seated to a standing position, like getting out of a chair or getting out of a car, right? While Harry has trouble and stiffness while trying to stand up. And like most people dealing with these problems, they're trying all kinds of different stretches and treatments, right? And they're not really working. And it's probably because they're not targeting the right source. And of course, while I was chatting with them, they wanted to know, hey, Dr. Charlie's like, so based off what I'm dealing, what do you think is the cause? And so let's break things down step by step in case you're watching and maybe dealing with some type of butt or leg problem. So first things first, even though neither of them really describe back pain, my experience tells me that most butt pain is actually due to an upstream problem in the back. So in order to make sure that the back is not the problem or kind of rule it out, we can just have them move their back in a couple of different directions, right, to see if it actually reproduces or makes their butt or leg pain worse. So let's watch Lloyd move his back. This and this.
So those things there, yeah. I mean, I think I said when I bend backwards and to the left, that's when it hurts.
Yep.
Or it doesn't hurt, but it kind of pinches. It feels like someone's gone like that on the back of my butt. And
now let's watch Harry move his back.
All right, so when I'm bent back straight like this, I'm feeling pain in my buttocks.
Okay, and you have no back pain, right?
No back pain. And just standing around, I have a lot of pain right there.
Yep. Okay, got it. So as you can see in both cases, we were able to reproduce their butt and their leg pain by having them move their back. Specifically, right, in this case, or at least for both of them, when they kind of twist and arch backwards to the painful side. And because of this, it becomes very clear that the back, or something in the back, is causing the problem, right, and is able to reproduce, again, the pain that they feel. And this basically proves that it is not piriformis syndrome. Instead, it feels very much like piriformis syndrome, which is probably why Harry got a shot in his butt, but it didn't work, but it's actually something higher up, in this case, the back. Next, most people with leg pain think that they have sciatica. It's this kind of catch-all term that's thrown around. If you have any type of pain in the leg, it's like you automatically have sciatica. But it's actually not very common. So most of the time, pain that is felt in the butt and or the leg is actually referred from some site other than the butt or the leg, usually coming from the back. In which case this is referred pain and not sciatica. But sometimes a pain in the butt and pain going down the leg is sciatica, in which case it's called radiating pain, or pain due to irritation of the sciatic nerve. And we can begin to differentiate between, do you just have referred pain from some structure in the back or higher up, right, causing your butt or leg pain, or is it radiating pain, sciatica, by doing a simple test called a straight leg raise test. And so let's make this super clear using the real live example of Harry and Lloyd. So watch this.
The left one's fine.
Yep, totally. So you see that when Lloyd raises or stretches his legs, either leg, it doesn't really matter, doing what we call a straight leg raise, he has no restriction in motion and it does not cause him any pain. And this tells me with a very high probability that he does not have sciatica or irritation of the sciatic nerve. He doesn't have radiating pain. Now let's watch Harry do the same. When you sit down, do your right leg and then do your left leg, straight leg. Stop whenever you need to. You don't push it through symptoms. Just
all right, ready? Right leg. Okay, let's see. All right, so the left leg, right there, you start to feel it.
When Harry raises his leg, it's fine on the right side, the good side, right? But when he goes to do it on the left side, you can see that he struggles, right? It's painful and it's limited. And this tells me that his sciatic nerve is sensitive and he most likely has sciatica. So to summarize, here's what we know so far. Even though neither of them have a pain in the back, moving the back reproduces both of their symptoms, right? So it causes Harry and it causes Lloyd to experience the familiar pain in the butt, hip, and leg. Therefore, we know they both have a back problem of some sort. But Lloyd has a normal straight leg raise, and Harry has a painful and restricted straight leg raise on his left side. So this tells us that Lloyd does not have sciatica. He has referred pain from something in the back, but Harry's nerve is sensitive. His nerve is angry. He does have sciatica, and this is a radiating pain. Finally, I want to revisit this. Remember I mentioned in the beginning that Lloyd has no trouble going from a seated to a standing position, but Harry does.
All right. And that's the hard thing is standing up. Once I stand up, because it's very, it's very tight, and once I'm up, I'm okay.
What's that all about? So this is potentially a useful piece of information because research and experience suggests that if somebody has trouble transitioning, going from a seated to a standing position, for example, right, they could have a disc-related problem. And this sort of makes sense with Harry's story because disc problems are the #1 most common cause of sciatica. But what about Lloyd? Something in his back is clearly causing the issue, but his nerve is fine. So what's the most likely diagnosis? What's going on, Charlie? Well, it's hard to say exactly because many things, the discs, the joints, the ligaments, the muscles in the back can refer pain to the areas of the butt and the leg. But based off the motion that reproduces his pain, rotating and extending to the left side, and his age, somewhere in his 50s, and his ability to stand up without pain, chances are that the most likely source or cause of his symptoms is due to a joint or facet joint problem in his lower back. And given the location of his symptoms, kind of on the back side, his butt, back of his leg, into his calf, we're probably dealing with a joint problem in the L4, L5, or L5, S1 area. Now, we need to know more, but the other sort of possible diagnosis in the deck of cards, if you will, right, would be an SI joint problem. Why do I say this? Well, oftentimes SI joint problems are caused by rotating and extending to the painful side, right? They can also refer pain into a very similar area, into the butt and or the leg. But there's one piece of the story that's inconsistent with an SI joint issue, and that is that he describes no pain when transitioning or going from a seated to a standing position. So research shows that if you have trouble transitioning going from a seated to a standing position, it's more likely to be a disc or an SI joint problem and not a joint problem. So there you have it, two very similar cases of left-sided butt and leg pain, and given what we know, without an MRI or anything like that, we were able to get a big picture idea of probably what's going on. Lloyd most likely has a facet joint problem, or perhaps even an SI joint problem, causing the referred pain that he experiences into his butt or leg. And Harry most likely has a disc problem causing sciatica, or radiating pain into his leg. So here are some key takeaways for you from this video. So number one, regardless of whether or not you have back pain, in most cases, if moving your back reproduces your buttock or leg pain, then chances are your back is part of the problem. There are some exceptions, but usually if you can move your lower back and cause symptoms below or downstream, right, then the back is really the origin of the symptoms. And also understand that just because you might experience pain in the butt or leg doesn't mean that you have sciatica. Again, this is something a lot of people believe that they have, but very few actually do. If you do the straight leg raise test on the good and the bad sides and you have no problem doing so, it's not restricted, it doesn't reproduce your pain, again, there's no issue, then you can be very confident that you do not have sciatica. So hopefully you found this valuable. Nonetheless, hopefully you found it interesting. And so please be sure, if you're wondering what the heck could be going on with you, please download my DIY diagnostic guide to help you determine the most likely source of your pain. And that's all I've got. So please like this video if you actually liked it. Please comment below, let me know what your thoughts were, and then hit subscribe as well as the bell for notifications when I go live with new videos every single week.